Okay, so I'll go ahead and get started. So welcome. I am Janet Kovak McClaran, soft tissue surgeon at London Vet Specialists. Welcome if you're joining us live or at a future date and listening to this at your leisure. Either way, I'm happy to entertain questions in the chat or shout them out. Similarly, if you are watching this as a recording at a future date, my information and contact details are at the end, so you can get in touch about any questions that arise from this discussion or any other questions about surgery that may pop up. For those of you who know us, London Vet Specialists are part of the Linnaeus Group, so a nice mix of specialists and primary care practices. At LVS, we're located in Belsize Park, Hampstead, and have a full array of specialists available to help you with your patients and answer any other questions that you might have about cases. So feel free to get in touch. And again, our contact details will be at the end. So tonight's Journal Club topic is going to be about spaying and incontinence. So this is a question I get asked about all the time. And there have been some recent articles that have come out trying to get to the bottom of the causes for spay-related incontinence. How are hormones involved? And the question I often get is about the timing of surgery, the age of surgery for our patients, if that impacts upon the incidence and prevalence of incontinence, and does the type of surgery, ovariectomy versus ovarian hysterectomy, laparoscopic versus open, does that seem to have an impact or a difference in terms of the incidence and prevalence of incontinence? So just for definition purposes, we'll use USMI, which is urethral sphincter mechanism incompetence throughout the Journal Club, because that's one of the keywords that'll come up. And why it happens essentially is related in dogs and people to a loss of estrogen primarily. Estrogen is important in terms of the collagen content. It affects the musculature and the thickness of the urethra. So the changes in these tissue structures and the thinning out of the vasculature seem to be related to incontinence. Certainly, there appears to be more than just estrogen at play, because as you know, if you try to manage these patients with just replenishing the estrogen, that alone does not seem to fix the urinary incontinence issues. There are also alterations in FSH hormones, LH concentrations as well. It does appear that the conformation of the animal, as well as size and breed of the animal, do have an impact also on their incidence of incontinence as they age. Other things like tail docking, vulval recession, and position of the bladder within the urogenital tract all seem to be also correlated or impacting upon incontinence levels. So in terms of how to diagnose USMI, if it comes up in our patients, a complete history, physical exam, blood work, urinalysis really is important. And that's just as an overview, some of the things that are missing in some of these journal articles that make it difficult sometimes to draw conclusions. So why is this being studied? Why are there so many journal articles out there? Just because the different studies that have been out over time seem to show a general trend to spayed dogs rather being more affected by incontinence than entire bitches, but it's not across the line. So one study showed only 3% of patients that encountered urinary incontinence in primary care when they were spayed, and another study had up to 20%. So it's a huge variation. And again, this is important. They followed one group from 12 weeks of age and found that there was a difference. Only 1% of dogs that were not spayed developed urinary incontinence in this 5-year follow-up, but about 5% of dogs that were spayed had urinary incontinence. So it's an important topic. And also, things are unclear. Is there an association between the timing of the spay relative to the first estrus? Again, this also has been relatively inconsistent. So a Swiss study looked at dogs and found they had actually lower risk for incontinence if they were spayed before their first estrus. And then a contrast, a UK study found that dogs that were spayed before their estrus actually had a higher rate of incontinence. And then finally, there was a 2012 review, and it seemed to show completely conflicting information and identified that there was actually no association between the rates of incontinence and the occurrence of spaying before or after estrus. So, and again, if there's any questions coming through as we go, please let me know. So the first article of the 3 that we'll go into was a Pet Savers paper. So this is a huge study that they looked at just medical records of 300,000 dogs through the Vet Compass electronic patient record system. And then they tried to case control 3 patients that had urinary incontinence and were spayed to a similar population in terms of size and age matching to dogs that had not been spayed. So again, the background we discussed and the reasonings for designing this study was that there are conflicting information, right? Some studies show that there's a difference in timing with estrus and others show not. The other thing they wanted to look at, is there anything in the patient population, size or body weight, that may contribute to development of urinary incontinence as well. So the objective, as we mentioned, was to further explore the association between, unfortunately, all causes of incontinence. So they didn't do a very good job in this article. If that's something that you read, you might have picked up on, that they looked at all cases of urinary incontinence, not just urinary sphincter mechanism incontinence. So they didn't have physical examinations on these pets. So that certainly is a downfall of the study. But they tried to say, if there's an impact on the spaying status, the age of spay, and the spay timing relative to estrus on their incontinence. So what did they find in this study? They looked at all the other confounding factors, and they did find, which many of us suspect, that dogs that are spayed are 3 times as likely to develop urinary incontinence compared to dogs that are not. So that's certainly an interesting finding. They also found certain breeds, as of course we also see in practice, seem to have an increased odds compared to other dogs. So they found that Vizslas, Dobermans, and Weimaraners and Boxers were all significantly more likely to be incontinent compared to other non-designer crossbreed dogs. So, as I mentioned, there are some limitations of the study. Only 30% of the dogs that they looked at actually had information about how old they were at the time of the spay. So that's actually a pretty low number to draw conclusions on. And certainly for a question of whether to spay before or after estrus, that information was actually not available in the records for over 85% of the cases. So again, that's a bit of an issue. They called this an exploratory study, so it was not hypothesis driven, which certainly is a downside to the article. But again, we have some conclusions that can be drawn. They did find, again, that spayed bitches were certainly at increased odds of urinary incontinence compared to entire, but they didn't really find a clear trend in this article between age of the spay and the urinary incontinence. The other thing they did find was body weight had a huge impact. So they found that the dogs that were larger in this study, 30 kilograms, although other studies have said 25 kilograms, have the highest odds of developing incontinence. So certainly a well-intended study with some good information, but not answering all the questions that we might have hoped for. So if anyone has any questions about that, feel free to interrupt, or any points of discussion about that article, let me know. So we'll move on to another retrospective study. This is also a case-controlled study. They looked retrospectively at 163 dogs that were spayed that did have urinary sphincter mechanism incompetence, so a little bit better of a study because these data were, all the patients were examined by a veterinarian and had more thorough medical records to review rather than the previous study. And then they did, again, case control match those with healthy continent dogs across 16 hospitals and try to find the objective to find the impact of age and also spaying at presentation and how that impacted on the rates of incontinence. So this was more of a hypothesis-driven study. They thought that dogs that had USMI would have been neutered at a younger age than the dogs that were normally continent. They also hypothesized that dogs that were larger in size would be less likely or less at risk for incontinence. And they also thought that dog owners would likely seek help and attention of clinical signs of incontinence for about, if the signs had persisted for about 3 months in time. So a lot more information and details that can be gathered from this study rather than just a huge hospital record review. So some interesting findings they found in this 136 incontinent dogs, that the reported time from onset of incontinence from the time of their surgery was about 3.73 years, so 3 to 4 years of age, 3 to 4 years following surgery, but that the incontinence can occur anywhere between 5 and 5,000 days following spay surgery. So that's an interesting finding. They did, based on the dogs where they had information available, that most of the time, if the dogs were incontinent for an average of about 21 days before they presented to the veterinarian. And they, in this study, didn't find any significance in the median age of the dogs that were spayed in the study group until the body weight of the dogs were over 25 kilograms. So that's really interesting, right? So the risk of USMI is not decreased in smaller dogs by delaying spaying. So if you have a small breed under 25 or 30 kilograms, really you can recommend spaying them based on this study at any point. There's no need to wait or delay their procedures. But they did find that in dogs that are larger, so in this study 25 kg versus the 30, in the other study, the timing of neutering is impactful. And so for every month that the spay was delayed over about a year of time, there was a diminishing risk for incontinence by about 11% of time. So that's certainly very interesting. So in large breed dogs, we'll talk about, there might be some other reasons to delay spaying. But for large breed dogs, it seems that waiting at least to 12 to 15 months of age is going to be a good idea. So, and this study didn't find any breed-related impact again. So there were some study design limitations here. Although the patients were all evaluated, there wasn't really a uniform medical evaluation, and they were evaluated with a complaint of incontinence. And they all had, or most of them had, urinalysis performed, but there wasn't any standardization to the rest of the evaluation. Only about 10% of those patients had a culture and sensitivity performed. So certainly we can't say what the impact of infection might be in these cases. So that's a downside. So any questions on that study, let me know. But again, based on that study, it does seem that waiting for as long as it might be appropriate for that patient or that client in larger breed dogs is appropriate when the dogs are larger size. So finally, the previous two studies, primarily the patients had ovariohysterectomies, and those were done through an open approach for the most part. So now that laparoscopic procedures are becoming more common, a group out of Washington wanted to look and decide if there was a difference in the acquired incontinence rates between dogs that had their spay done laparoscopically or open laparotomy. So a similarly retrospective matched case control study was performed, and their hypothesis was that the laparoscopic approach might reduce the risk of incontinence after spaying. And this is something we all were hoping for. Maybe there's less pulling and tugging on the ovaries, and that might lead to a lower risk for incontinence. So they also tried to case match all these cases very thoroughly, not just on age and breed, but body weight, time of spaying, the age of spaying, time intervals in spaying, the age of the dog. So they really tried to case control and match these well. So they found 154 matched pairs of dogs that were spayed laparoscopically. Now, a downside of the studies we'll talk about is that not all of the dogs had just one procedure. So some of the dogs were laparoscopically had an ovariohysterectomy, and some had ovariectomy alone. So that is a bit of a flaw in this study. The study was very thorough, and there was an owner questionnaire that was performed that had 18 questions, so quite detailed, asking people about the time since they're spaying. They wanted to follow up for 5 years. They only included dogs when their first episode of the incontinence occurred after spaying, and they ruled out any other issues or diseases that may have caused the incontinence when they made sure they didn't have any PUPD, and any dogs that were incontinent related to anything suspicious or unrelated to spaying, such as endocrine problems, metabolic problems, other medications that may cause incontinence, were all excluded from the final analysis. So a really thorough study. Being that thorough, they did find a very high rate of incontinence in this population of patients. So almost 20% of the dogs that were spayed versus open or laparoscopically seemed to be affected with incontinence. So a very high rate, and I think that's because they were very meticulous in their records in terms of picking up any signs of incontinence. They did find that breeds, again, large breed dogs, Dobermans, Ridgebacks, Danes, Huskies, and Vizslas were all the higher risk breeds. And generally, the spay incontinence was noted. The spay incontinence was noted about 5 years after spaying, but it could have happened anywhere between immediately or up to 13 years after spaying. So the other thing is they had a very long follow-up period. So they picked up a lot more cases of incontinence because they followed up some of these cases up to 13 years. So they really did pick up a lot more cases of incontinence. And in general, the definition of incontinence was up to leakage up to 7 times a day, but on average, patients were leaking about 5 days of the week. So they, this point, didn't find that there was any impact on the time intervals in spaying and the age, but the surgical approach, body weight, body condition score, and age at spaying were not related to risk factors. So again, this is a little bit of a well-done study in that it has higher rates reported than others, really stringent, but there wasn't really a uniform grading scale. And of course, higher prevalence rates are going to be observed with a longer study period. And so they also had body condition score being assessed by clients rather than the medical examination. So maybe that's why they didn't find body condition score to be very reliable. So again, in this study, they found a very high rate of urinary incontinence, up to 20% of the dogs. And usually it occurred about 5 years after the procedure, either open or laparoscopic. And so although there are lots of benefits of the laparoscopic approach and it allows for the fast recovery, less pain, it unfortunately in this study didn't seem to reduce the risk for urinary incontinence. So overall, this was a valuable study and well designed. So again, any questions about that, feel free to pop those into the chat or let me know. So finally, what conclusions can we take from all of these studies and how can we put those into our clinical practice? So it does seem the factors that are important in terms of dogs that develop incontinence seem to be the size of the dog and the breed of the dog. Those are factors that come up a lot, and also the age of spaying dogs that are greater than 25 kg. Interestingly, spaying, a lot of people always say, my breeder said to wait until the first heat. The timing of the pre or post first estrus didn't seem to be something that came out in these, again, all retrospective studies. And also the type of surgery, so ovariectomy, ovarian hysterectomy, laparoscopic, or an open laparotomy all seem to be equal in terms of their those patients developing incontinence as they age. But there are lots of other factors that go into the decision making that are controversial. So I've gotten some summary charts in here, lots of other things to consider, and lots of articles that talk about spaying and the timing of spaying as it relates to things like osteoarthritis. Certain breeds may have a predisposition to cancer development depending on the size of the dog, the breed of the dog, the age. Certainly, we know there's an impact about behavioral changes in dogs. There's even a study that looked into disease transmission in shelter pets, whether it was better to spay them before they left the rehoming shelter or when they went to the general practitioners. So timing of spaying can be very controversial. So I put up 2 slides just to peruse at your leisure that kind of go through. Is a really nice review in the New Zealand Journal of Vet Medicine that came out in 2015. It wasn't per se part of the journal club, but I thought it was interesting. Kind of did a summary on the current perspectives of the optimal quote unquote age to spay and castrate dogs. And I'll give you a hint. The conclusion of all this is that we don't know. Certainly, it seems that in general, we could tell our clients that dogs, females and males that are spayed, in general, according to the study or summary of studies, do live longer. They lower the risk of pyometra, lower risk of mammary tumors, lower risk of BPH, and there's the risk unknown a bit from testicular neoplasia. But there are some breed-specific information that if you have someone who or a breeder may certainly have this information at their disposal. So good to have some of this information here. Some of the more interesting studies relate to arthritis and cruciate diseases, elbow dysplasia, hip dysplasia in Labradors. And that study really does show that delaying spaying to greater than about 12, 15 months of age will diminish the incidence of some arthritic diseases and the cancer risks. There's a lot of controversy, but I put those up there in the review for you guys to take a peek at, so you have some of that information at your disposal. So what do our associations recommend based on all of this information? In general, the AVMA, the American Veterinary Medical Association, the BVA, British Veterinary Association, still see to let us know that there's so many different, no one size fits all in terms of recommendations. So there's definitely seem to be many more potential effects that are positive in terms of spaying dogs, but we need to have a risk-benefit analysis depending on the breed. And also similar saying that there's no specific scientific evidence to support spaying after the first season, because that is something that we hear all the time from our clients that the breeders recommend. So that's something that doesn't really hold water. In terms of spaying and when to wait if they do come into season, from a surgical perspective, I usually like to wait about at least 2 weeks. And again, there's no evidence for that, but that's sort of the general consensus that waiting a 2-week period until the bleeding risks have abated and the tissue is less friable seems to be a good idea. We do get lots of people that come in and say their vet or their breeder advised them to wait until 3 months of age, 3 months after their season, in order to benefit their dogs. But I couldn't find any evidence to where that recommendation comes from. So in my mind, my overall recommendations are yes, for large breed dogs, waiting till they're a bit older in age. Doesn't really have to do anything with their seasons, but waiting till they're older in age seems to be of benefit to those patients. And small breed dogs, really it's convenience and timing. So generally we will spay the small breed dogs. The procedure of choice for us at London Vet Specialists is generally laparoscopic ovariectomy because it's such a quick recovery time. And as I said, although the study doesn't point out, unfortunately, the benefits include diminishing the risk for urinary incontinence, we do find many other benefits that go along with a laparoscopic approach. So that's all for me tonight. So I'll let everyone get back to their evenings, and I appreciate everyone's attention. Again, if there are any questions, people can answer them, people can forward them to the information I put up here, which is email, phone, or if you have any referral questions, please do get in touch. If there's anyone out there that has any questions, please let me know. All right. On that note, I will conclude, and thanks to everyone for their attention.
Thank you. Bye.
Thanks, Janet.
Bye. Thank you.
Thank
Thanks.
you.
Bye.
Thanks, Janet.
Bye.